Welcome to eAssist Growing Your Dental Business podcast. Tune in as the experts in dental business share tips and tools to grow your practice. To learn more, visit dentalbilling.com. Please welcome our next guest.
Well, hello, everyone, and welcome back to another episode of the Growing Your Dental Business podcast. I'm your host, Jacquelyn Hurley, and today we have an incredibly insightful episode lined up for you. Whether you're a dentist, an office manager, or even just part of the dental team, today's conversation will be packed with visible tips to help you optimize your practice. So I'm super excited to introduce Sophia Dunkley. She is a pioneering force in dental practice coaching and consulting. She has over 25 years of experience in the dental industry. Sophia is known for her innovative strategies that transform office dynamics. She can help boost case acceptance, helps practices grow. She has worked with a variety of practices, including general, restorative practices, multi-specialty startups, and DSOs, and has supported dentists who have pursued advanced training at prestigious institutions like NYU, FMR, Pinky, Kois, and LVI Global. As a certified leadership coach and esteemed dental speaker, Sophia specializes in case acceptance, dental implant sales training, and creating a culture of leadership that improves both patient and team engagement. Her unique philosophy is about transforming strangers into friends, which enhances both patient success and team cohesion. I love that. I love all of that, Sophia. I know you're really good at that because you turned us from strangers into friends.
Oh, thank you. Thank you so much. You know, it's become the central focus of what I do, being heart-centered. So thank you. That was a great introduction, by the way.
Well, I just thought I got to fit all this in. Has done so many things, and you've done a lot, especially when it comes to being a dental coach. So I love that. I love just sharing all of that. And I want people to know that you are an incredible lady and you really do help dentists on a day-to-day basis. So let's jump in. Tell me a little bit how you even got into dentistry.
Oh my goodness. Yes. So I started back in the 90s, 1994 exactly. I was at Hunter College in New York City and I went to the job placement office. I needed a position that can help me, pay for school and, be able to make it through college. And so I started working in a dental office and that's where it started. I discovered the passion for dentistry. I started clinical assistant initially and then quickly became an office manager. And over the years, I was fortunate enough to work with doctors who were working with consultant firms. And, for me at the time, I felt the gap was, they were spending a lot of time speaking with the doctors, but they were not really communicated and directly motivating me as a clinical support, the front office administrative support. And so I started to think, well, what if I go that direction and start to learn about management and consulting and how to keep an office profitable? And I started in the 90s and, back then there weren't as many consultants as there are now, and there were not as much resources as there are now. So I had some mentors, like Kathy Jameson. I've done some advanced training at NYU, and NYU had a business management program specifically for dental office managers and dentists. It was like a two-step program, like a mini MBA program. And also I went to LVI Global for quite a few years to be able to be trained on advanced dental practices and how to run an efficient, high-producing, highly effective dental office for quite a few years. So I've done a lot of training to be able to deliver the level of support that I bring to the dental office environment. But most importantly, I'm in the trenches with the team, so I see their day-to-day. And I've been doing it now over 25 years, I like to say.
That's amazing. That's a lot of history right there that you have experienced. And I love that you mentioned Kathy Jameson. I love her. She is such a sweet, sweet lady. Her and Dr. Jameson have had their practice for many, many years. And I love that. So thank you for sharing all of that. So With your experience in coaching practices, can you kind of walk us through how do you have a step-by-step program that you go through to help dentists become more profitable, or how do you do that?
Sure. So, when a dentist reach out to me or an office manager reach out to me, the most important thing is to really establish what is it that they ultimately want and why, right? Because if we don't have that established as the driving force, then we're not really going to be able to accomplish our goals. It doesn't matter how great a consultant I am. But my process is really going in, really understanding what's going on with the team. Is there a disconnect between the team and the dentist, or the team and the office manager? And then also understanding that no office can function without a supportive team, and vice versa. No team can survive without a supporting doctor and leadership. And so without those two dancing together well, we're just going to play the blame game. So for me, it's really understanding what is the core problem. Is it a systems problem? Is it a communication problem? Is it a stress level problem? We often overlook the role that stress plays in all of this and how we react to different circumstances and situation. And as a certified coach, I'm able to pick up on that. So I'm really trying to understand what it is that's blocking us from getting to where we need to get to. And then we start our 3-step process, which is our people, processes, and profitability. And so we start to look at those 3 factors.
Wow, I love it. So it sounds like there's really could be a variety of reasons that they're not being profitable. And it sounds like someone like you can step in and just kind of see exactly what is happening between the team, between the doctor and the team, or the team and the doctor, like you say. I look back, my daughter was an office manager for a pediatric dentist, and I just remember listening to her kind of work on the schedule, work on everything, and everything was for that doctor. Like, she had so much respect for him. She knew what he did and didn't want to do as far as the schedule goes, as far as the team goes. And she just took care of all of those things that she knew, he had other things to work on or worry about. And so she knew exactly what she needed to work on and worry about. And I felt like that was a really healthy relationship they had. And so it's really great to hear you kind of explain how you dig into that step-by-step process, because I can see how you would need to figure all of that out and what's not being healthy in the practice at the time.
Absolutely. Because I could bring in all this fantastic knowledge and experience, but if there's a block, I won't be able to accomplish anything, right? Yeah. So having a conversation, understanding what's causing the bottleneck, what's causing the miscommunication, what's causing the lack of drive, what is causing the lack of drive and passion. Many times we really don't pay enough attention on the fact that the administrative team and the clinical team does not have enough support, and they have not been trained, and they have no one to go to when they're stuck, because the doctor, who may know, is providing clinical care, and that the front office manager, who may have the knowledge, may be busy doing something else, maybe working on presenting cases and closing cases, or doing something related to management that does not allow them to be available to train and develop team members and to support them. And so having someone to be able to support, train, develop, and help your team members understand and work through those difficult moments will create that eventual accountability, because then they understand what they're doing incorrectly and can improve. So another way that doctors can be profitable in their practices, by having a system where we are able to outsource some of the tasks that takes our team away from being able to focus on patients. So like working with a company like eAssist, we can outsource the entire revenue cycle management process, submitting the claims with accuracy, following up with the claims, ensuring that that aspect of the practice is being managed efficiently so that the team is freed up to be able to do your patient experience, to be able to present dentistry to your patients and be able to get acceptance. And so eAssist is able to support practices by definitely offloading that very detail-oriented work so that an office manager or front office administrator is now fully available to grow the practice and focus on patient experience to be able to get the practice to be more profitable. So this
Oh,
is something that I think is amazing.
thank you, Sophia. I appreciate that. One thing I've noticed with dental teams is sometimes there's turnover, especially in their dental billers. And it's nice to have that third party dental billing company because it keeps your cash flow more predictable, just
Yeah.
keeps coming in, flowing in. And then, like you say, the other team members can do all of the other things that keep the patients happy. You want the team to be happy and the patients to be happy. So let eAssist take care of all that busy work in the background.
Absolutely. Especially when there's a turnover, then that's when you start to see that the claims didn't go out on time and there's timely filing. ESS just kind of keep that aspect running in the background so everyone can focus on what's happening in the practice on a day-to-day. And it takes away so much of it's I call it subconscious stress, meaning that it's one other thing that we have to do that adds stress but because it's demanded and it's detail oriented. And ESS definitely helps with taking that load off.
Well, I love that. It's such an important point. Really, when it comes down to it, you just have to have strong systems in place to know who's going to be training what and when and how and why. Like I remember you started this whole conversation with you need to know the why and then you need to figure out the
Yeah.
how. So that's great. So when a practice is struggling, let's say they're struggling with team accountability and communication, how do you coach leaders to kind of, in every practice, you kind of want the patient first culture, right? And so it's kind of tricky to coach leaders to help create that patient first culture. So how do you do that if they're struggling with that team accountability?
So absolutely. So when I go into an office and there's leadership and accountability challenges, no one wants to be told that you are not a great leader. It's almost like a swear word. When you say it's a leadership problem, everyone looks at you a little like, what do you mean? So I try not to do that, right? So my objective is to create an awareness. And the way I do that is as a leadership executive coach, I am trained to be able to administer what is called the ELI 360. And the ELI 360 is an assessment that basically it analyzes one's stress response to different scenarios and situations in a dental office, but also it basically gives us a 360 view of the 36 leadership competencies that are required to be a great leader, whether it's the office manager, the dentist, or any of the team leads. So we're assessing the 36 leadership competencies that are needed to run an office direct efficiently. The entire team goes ahead and gives their evaluation, and you get to do a self-evaluation as well. And based on that, it's going to show us your stress response. It's going to show us the areas that you're not basically being viewed in the same lens that you see yourself. And so that creates that awareness, and then we can work on that together to coach to how can we better communicate, whether it's verbally or non-verbally, how can we better present and show up as a leader in this particular segment that we're having challenges with in order to address any issues that we're having in the practice.
Wow, that sounds like a really humbling experience as a leader. There's 36 different items you're kind of being tested on. So that does sound kind of like a humbling experience. How does that typically go when you go into a practice and do that for the first time?
Well, what I find is that the awareness that it creates is very humbling for the person. And so what I've seen through my experiences is that they go, "Oh, it's not that there's something wrong with me. It was just that I didn't quite understand what I was consistently doing that was creating conflict or confusion or miscommunication. Let me go back and see how we can work together and build in a strategy how to prevent that from getting worse or prevent it from happening at all." Right. So the first reaction I get is, wow, okay, this is what I expect, or wow, I didn't expect this, or oh, wow, this is really eye-opening. How can I get to where I want to be? Most of the times it's, wow, this is really eye-opening. How do I get to where I want to be?
I love that because then you've got that genuine want to make it better. The person wants to make it better, wants to fix everything. And that's, I think that's the best place to be. Do you find that they've got old habits that are hard to get rid of in those experiences?
Absolutely. But here's the key. If the doctor or the leader or the office manager wants to get better and they tell me this is their why and this is their goal, if they choose not to address that, they're not going to get to their why and their goal. So it becomes, here is my awareness. These are the challenges and areas that I need to work on. This is what's getting in the way of my case acceptance. This is what's getting in the way of my team following through. If these are truly things that they want to address to get them to the level of success that they're looking for, the choice is theirs, but I think it's pretty obvious if we don't address that, we're just not going to see that level of improvement.
Sure. It kind of is, it's a level of vulnerability, right? When you're a leader in a practice like that. And I think once you're vulnerable as like a office manager or a dentist trying to combat and figure all of this out, it kind of creates a sense of the rest of the team wants to be vulnerable too and figure out, their contribution. What are they doing and how can they contribute to these practice goals too?
Absolutely. Absolutely. And what I find is two kind of leaders. They're leaders that lead by force. And so it's, almost like micromanaging, and I demand this and I demand that, et cetera, et cetera, et cetera. And what happens is you will see some improvement or you will see some effectiveness short term, not sustainable, and you lose a lot of team members because it's just not a healthy environment. And then you have the other leaders who are like, okay, you know what? I don't want to rub anyone the wrong way. They don't want to ruffle any feathers. So they may sit back in the office and kind of just be really, really quiet because of fear. And those leaders are the ones where you go in and you see the team is like doing whatever they want. And the doctor is in the office suffering in silence, or the office manager is suffering in silence. And so when we create those type of awareness and then we put the team together to work together, it's amazing what happens. Communication, even if all you get out of it is better communication in a dental office, is powerful. And so I have seen this to be tremendously effective. And that's why it's one of the three things that I address right away. Like, I know how important it is to have that level of collaboration in a practice.
I love it. It just really, that culture of communication is kind of that foundational success. And if you can dig right into what's happening there, then you can solve a lot of issues.
Yeah, absolutely.
That's wonderful. Thank you for sharing all of that. I think all of that is just really incredible knowledge. Like I can see a dentist listening to this thinking, okay, what kind of a leader am I? Am I a demanding leader? Or am I one that sits back and lets my team kind of just run the show? What kind of a leader am I? And just, if nothing else, I would think that having you come in and go through that whole leadership process would be beneficial for every practice.
Yes. Because as a case acceptance coach, I've been doing this for 20 something years. Case acceptance, I've been in scenarios where there is no case acceptance process and help them implement one, or there may be a case acceptance process, a treatment acceptance process, and I work on helping them to improve that. But without the people, without the work culture, that process is not going to be as effective. And so you'll find that there's some people that can get patients to say yes to dentistry and, accept dentistry. However, the work culture is not where you would want it to be. And so no one is happy. And sometimes the patient experience is not to the level that we would want because the work culture is just not at that calm, soothing, customer service oriented environment. So if I can create that awareness, then we can reverse engineer everything. Case acceptance is one of the main cores in a practice. We cannot manage our profitability. We cannot manage our overhead without addressing case acceptance. And so it's important to really, really tie the two together.
That's great. I love that. So let's move into another thing that I know is it's kind of a big pain point for practices. And a lot of times it's no-shows or non-committal patients. Seems like that can kind of often lead to a major source of frustration. What are there strategies that you recommend to kind of ensure new patients not only book their appointments, but actually show up?
Yes. And it all goes back to having a process, right? So, what is the verbal skill training and support that the team has throughout the entire patient journey, the entire patient experience? From the minute the patient calls the office, one, are the phones being answered and answered accurately or properly, consistently every day? And when they do answer the phones, how will they position in the practice? So, what is the positioning statement for the practice? How are you edifying the doctor or the hygienist or even the team? What is it that you're saying about your practice community, your dental community in your practice? What are the things that you're saying on that phone that's going to make your practice stand out from any other practice in the area? And on top of that, once your patient gets to your practice, how is it that you're educating them on what your cancellation policies are? Is it just on the form and no one ever mentions it? It's like the secret policy that no one ever talks about. Or do we have a conversation about that? Patients in our practice tend to keep their appointments. And if they can't make the appointment, they give us at least a minimum 48 hours in advance verbal communication or text saying that they would need to reschedule the appointment. Yeah. But for the most part, our appointments, we have a team here ready and waiting for you. Doctor will be excited to get you to the highest level of health. And we will be definitely able to take care of you. We ask that you do keep your appointment. And if you can't, let us know 48 hours in advance. How powerful would that be when you onboard a patient that you're educating them on what we expect and what are the things that our patient community does, so that way they know how to behave in your practice, right? So that will eliminate cancellations. When you're taking on a new patient over the phone, you want to set the standards and the expectations for those appointments also. What would you be expecting in your appointment today? Are we going to be doing a full comprehensive exam, head and neck cancer, oral cancer screening? Are we going to be doing a cosmetic evaluation? How much time should you expect to be here? How many team members are going to be waiting to be able to serve you, so that we ensure that you're definitely going to be here? And same thing, if you can't make your appointment, please call us, text us, and let us know with a confirmation that you will or will not be there. And also, I like to do a preheat call just to make sure those new patients actually show up. So there's a lot of things to train and support your team with to ensure that your patients are going to show up. And when you think about acceptance, all of this preheat and pre-touches sets up for the consult. It sets up for the treatment acceptance. So if we did the first half, the phone call, the patient experience, welcoming them and onboarding the patient properly, by the time we get to the point of identifying any dental concerns and putting the patient at choice, the process of getting the patients to acceptance, and I train and give verbal skills and support and protocol and how to do that in a way that is ethical and compassionate for the patient, so they feel good about having a healthy lifestyle, a healthy dental health, and a great quality of life as they get older.
Oh, I love that. That was a lot of information, but I think the biggest thing I got out of all of that was, I think the biggest frustrations come in life in general when there's unmet expectations. So I love how you walked out setting the expectation, even with a brand new patient phone call, just so that they know what to expect. And I feel like if you have that conversation, that level of trust is raising between that patient and that practitioner, so that they will have that level of commitment, that level of respect, so that they will reach out and let you know in advance if they can't show up. So that, I love it. I mean, it all goes together, but that kind of sounds like that's the beginning of that whole patient journey. And just setting the expectation is a huge piece of all of that.
Yes. Yes.
Great.
It's making time for those key things.
Yeah. We've talked about so many things today, Sophia. Such powerful insights. You've given a lot of strategies to help practices with profitability. You've kind of given us information on strengthening communication and also improving patient commitments. Is there anything that you would like to add before we wrap up today?
Sure. For me, the key is really understanding what I call the three P's. And I'm going to just kind of reiterate that because repetition is the key to adult learning.
I
You
love
know, having the people, the first P, having team members that are developed, having processes that support what our end goal, our final goals are, what are the things that's keeping us up at night, having a process to address that. And profitability, like I said, the fastest way to increase profitability and lower overhead is to increase treatment acceptance. So if we were to focus on those three things and reverse engineer the systems that support that, we will be able to have the practice of what we desire and the level of calmness in our practice. So that's the biggest takeaway. And like I always say, as a core belief that I have, really focus on making a stranger a friend. And so when our patients come into our practices, really learn how to create that connection quickly. And as you said, Jacquelyn, build that trust so that the patients feel, oh my goodness, I am in the right place. And once we're able to do that efficiently, you'll see the team members also start to, if they're strangers or we're onboarding a new team members, making that team member a friend as well. So it works
Sure.
not only with patients, but with teams as well. That's my final takeaway.
I love it. I love that you recaptured that whole thing because it really just puts everything into a nutshell. And I think of my daughter again, who was this little office manager. Some of her best friends she got out of that time. The dentist is now retired, but she has some really good lifetime friends just from working with them in the dental practice, right? So I love your whole saying about turning strangers into friends. I think that's a key. Just that tells a lot of who you are too. And I appreciate you being my friend.
Yes, yes. It's been amazing. And I have a photo of us together that I'm like, oh, I have to send this to her. So yes,
So
I
we had so
appreciate
much fun in Nashville, didn't we, when we were out there at a
it.
conference? Yeah, that was
Absolutely did. Yes.
so if there's someone listening to this today and they would love for you to come in and do that 36 quiz leadership, your whole leadership process of just figuring out, what type of a leader they are, if there's holes and strengths, and I'm sure it tells you everything, your weaknesses, your strengths, what can we work on? And it's probably really eye-opening to be able to just say, oh, now I know why I do this and I need to work on
Yeah.
that area or
Yeah.
whatever. So how does someone get a hold of you if they would like for you to come do that and get
Yes, absolutely. The ELI 360 is amazing. It was life changer for me. And yes, you could definitely reach out to me by going to my website and requesting a complimentary consult at www.thepracticenavigator.com. You could also text me directly on my cell phone number, which is the 347-577-9102 number. They could text eAssist revenue cycle management. And that way I'll know exactly that they heard this podcast. And I'm also on LinkedIn. You can reach out to me on LinkedIn as well. So, but I'm excited to support the community, help with case acceptance and, help doctors grow their practice to be profitable, but also develop great leaders.
Well, I love it. You've kind of covered it all today, and I feel like you've got so much expertise in all of those areas. You could help any practice with any one of those areas that they need help with. So, thank you for sharing today. Thank you to our listeners for being here today. If you're looking for more ways to streamline your practice's operations and maximize your revenue, we also would like to include eAssist Dental Solutions, who is our sponsor. Our team at eAssist is a group of experienced dental billers. They specialize in revenue cycle management. They're dedicated to helping you submit clean claims, reduce denials, and optimize your cash flow. So We would love for you to go to dentalbilling.com if you would like more information. Again, thank you, Sophia, and thank you to our listeners for tuning in. We hope you've gained valuable insights to apply to your practice. And until next time, we'll see you again. Thank you, everybody.
Thank you.
The purpose of this podcast is to interview the consultants within our eAssist Consultant Network. This podcast is for informational purposes only. For more details, please visit the homepage of this podcast platform at dentalbilling.com. Thanks for listening.